+251-909-537791. It is +251-909-537791. But you can also use the Q&A section section on the Zoom platform, or thirdly, you can use the raise hand icon to join us live and ask your question directly to the director. And please kindly mention your name and your institution when that you're representing before asking your question. So, colleague, without further delay, let me welcome Dr. Ahmed Ouma, the Acting Director of Africa CDC, for today's briefing. Thank you, Director, for making your time again today. We know that all of us are going into our holiday, but you wanted also to have this last press briefing to update the journalists. Over to you, Dr. Ahmed.
Thank you. Promise, good morning, good afternoon, good evening, wherever you're joining us from. And thank you for taking time off these last days of 2023 to join us here. Promise, we can hear you if you can mute. This is going to be the last briefing for 2023. It has been a heavy year, very momentous in many ways, and we are very grateful that we have managed to reach this stage in a way that has protected and safeguarded the continent's health security. And with your support, it has been made possible. So we are going to meet again very early in the new year. But for this year, this is going to be the last update that will be coming from Africa CDC, a live update. We will continue to engage with you using all other platforms, but in terms of a live update, this will be the last one. So today I would like to structure our conversation into four. First is I'll speak about the major public health events here on the continent. Then I'll speak about the outcomes of the international conference on public health in Africa that we held last week in Kigali. Third, I will give an update on the youth advisory team that I have established. And finally, I'll give you some takeaway messages, particularly now that we are going into the holiday season. Starting with the major public health events on the continent. We are currently having, during this past week, at least 105 different outbreaks on the continent, some small, some big. We are actively following up at least a dozen of them because of the nature of the pathogens and also the potential risk that they have. And today I will share 5 of the top ones, which are really public health events of concern that we would like the public to be actively aware of. First is COVID, and then second will be Ebola virus outbreak in Uganda. Third will be Mpox. Fourth will be cholera, and we'll focus a little bit on Malawi. And fifth will be Lassa fever. Again, this is a multi-country outbreak across the continent. So we start with COVID, and really it's a reflection of where how far we've come in the context of the growing numbers of COVID, both in terms of those being laboratory diagnosed, those who are being hospitalized due to serious illness, and those who are losing lives across the world. We have not seen that similar situation here on the continent of Africa, and we remain very vigilant to the growing surges in COVID-19 elsewhere in the world. Here on the continent, from the beginning of this pandemic, we have documented just over 12.1 million COVID cases, which is about 2% of the total number of cases that are being reported globally. We, at the same during the same period, have documented recoveries just over 11.5 million, which means 95% of the total number of cases that have been reported here in Africa have recovered. It translates to 95 people recovering out of every 100 cases, which is quite good for a continent like ours that had been predicted to suffer a lot from the COVID-19 pandemic. Unfortunately, we have lost 256,470 people here on the continent, which gives us a case fatality rate of 2.1%, really much higher than we would want. Losing 2 people out of every 100 cases that are being reported on the continent is not something that we would like. We would like to have that less. These number of deaths account for just over 4.1% of the number of deaths due to COVID globally. It's also important to reflect that COVID has affected our countries on the continent differently. And when you look at the top 5 countries by number of cases reported, we see that these top 5 countries account for 60% of all the COVID-19 cases that have been reported on the continent of Africa from the beginning of the pandemic. And as a recap, since we are coming to the end of this year, South Africa accounts for 33% of the total number of cases, just over 4 million. Morocco, 10% of the total cases, about 1.2 million. Tunisia, 9% of the total number of cases at about 1.1 million. Egypt and Libya, each with 4%, just over 500,000 cases for those for each of those 2 countries. So it is South Africa with 33%, Morocco 10%, Tunisia 9%, Egypt 4%, and Libya 4%. These are the top 5 countries that account for 60% of all the cases that we have seen on the continent. Now, looking back, using the 1 week, which is week 50, that week is between 12th and 18th of December 2022. And then we compare it with epidemiological week 49, which was 5th to 11th of December. We see that a total of 5,043 new cases have been documented during Epi Week 50 here in Africa. And this is a 4% decrease when we compare with the previous week. All regions have really shown stabilization, if you want, in the numbers of the new cases. And that's why we are seeing a decrease in the number of new cases for Epi Week 50 compared to Epi Week 49. But when we also look in detail at this number of new cases, we see that the following 5 countries are reporting the largest numbers, and that is South Africa with 1,341, Ethiopia with 964, Zimbabwe 819, Morocco 659, and Kenya 254. So the increase in during Epi Week 50 has spread out quite evenly when you look at the most affected countries on the continent. Unfortunately, during this same period, Epi Week 50, we have seen a total of 60 new deaths, that is 60 new deaths. And this represents a 39% decrease from the previous week, Epi Week 49. When we do the longer analysis over 4 weeks, we see that there has been an overall 13% average decrease in the number of new cases being reported here on the continent for that 4-week analysis. And when we look at the number of deaths over the same period of 4 weeks, there has been a 41% average increase during these 4 weeks. But I must hasten to add here that due to batch reporting from some countries, that's why we are seeing this spike in the increase in the number of deaths. But we continue to analyze and carefully look at our data that is being reported from our member states to see if there is any real cause for concern there. We continue to also monitor the surge in numbers from other parts of the world because we are so interconnected and this is the holiday season. We want to be sure that we remain very alert to anything that's happening anywhere in the world, because no one is safe until everyone is safe. So in the context of this new surge, we are actually enhancing support to our member states for surveillance, particularly at the community level, because the holidays are here. So we are strengthening our surveillance systems around the continent, but also encouraging our member states to strengthen their surveillance systems, particularly at the community level. We've also reissued our guidance on public health and social measures for the continent, and asking our member states to upgrade their own frameworks so that the members of the public can be informed on what to do and what not to do in the context of the surges that we are seeing elsewhere in the world. Third, we are increasing our support for genomic surveillance. We want to know this surge, does it have anything to do with any new variants or any new subtypes of the variants that will mean that we change the way in which we approach the pandemic. So our laboratories and experts are in full swing doing a sequencing for all relevant samples based on the protocols that we've established. So it is something we are closely watching to ensure that the continent remains safe. When we look at COVID-19 vaccines update across the continent, we now have 1,076,000,000 vaccine doses that have been delivered to 54 of our member states. And out of these, we have administered 856 million, which corresponds with 79.6% of the total number of vaccines supplied to the continent. When we look at coverage, as I have mentioned in the last 3 or so briefings, that we have shifted our denominator to the eligible population. Here in Africa, we have picked 12 years and above as the eligible populations for COVID-19 vaccination, and we are now aiming all our efforts at ensuring that this happens with some specifics, which I shall explain shortly. One is we want 100% of our health workers to be vaccinated against COVID-19. They're in the front line. They see every patient that comes within the health facility, and we want them fully protected because right now our strategy has shifted, and now we are doing testing and treating because the active community surveillance that we used to do before, looking for contacts and lockdowns, etc. That season is finished because of the vaccine is available and some treatments are also available. And so we are shifting to focus on particularly interest groups within the community. And health workers is number one. We want all health workers to be fully vaccinated across the continent. Second are the dual populations of those above 60 and those with comorbidities. Comorbidities means people with other illnesses that usually reduce immunity. These two groups, we want also 100% of them to be vaccinated. Everyone who is above 60 should get their COVID-19 vaccination. Everyone who has a comorbidity, whatever their age, they also need to be vaccinated against COVID-19. We are trying to protect the vulnerable from getting exposed to serious effects of COVID-19. For the rest of the population, our target is still 70%. And looking at the target population of 12 plus, we see that the fully vaccinated coverage on the continent today is 41.77% of this target population. And this corresponds with just over 388 million people on the continent that have now been fully vaccinated. So again, 12 plus years population, 41.77% have been fully vaccinated. When we look at the number of boosters, because countries are boosting those who are willing to go for their third or fourth shots, we see that the number of boosters today stand at 3.22% of the eligible population, and this translates to 43.3 million vaccine doses that have been given as boosters. When we look closely at the last week, there has been a 3.97% increase in the number of those who are fully vaccinated, and this translates to just over 14.8 million doses that have been administered in the last week. So we are making some very, very good progress in this regard. When we look at our countries who have reached that target of 70 plus for the target population of 12 years and above, we are happy to report that there are 12 of our member states that have actually reached this target. And these include Tanzania, Seychelles, Mauritius, Botswana, Rwanda, Comoros, Liberia, Cabo Verde, Morocco, Zambia, Somalia, and Mozambique. These are 12 countries on the African continent who have reached 70% of the target population within their own borders. So going forward, what we are doing with our member states is analyzing where the success, what has resulted in success. And some of the key things that we are seeing that have resulted in success is when we do mass campaigns. When we do mass campaigns, there's a lot of uptake, which tells us that the African population is still willing to be vaccinated so long as the vaccines reach them easily where they are. And apart from mass vaccinations, we are also now starting to actively work with the youth. You will recall we launched our Bingwa initiative. We have our Bingwas from across the continent, and we have been intensified in countries where the vaccination is still low, and we are seeing the result of that, with the Bingwas being out there actively engaging with their communities and resulting in better uptake for COVID-19 vaccination coverage. In fact, we are seeing that where our member states have done some special programs for the youth, then the uptake has actually gone up. We therefore recommend very strongly to members of the public that this season of the holiday, when there's a little bit of time away from work, get vaccinated. All vaccines that we have passed are good, so take the vaccine that is nearest to you during this holiday season so that you can protect yourself and others who are around around you as well. For those who are eligible, please get your booster shot. It is important that we increase the immunity as we go along so that you're much better protected, especially if the boosters are already being offered by our governments, and most of our member states are actually actively offering booster doses. So get your shot, get your booster, stay safe. This holiday season is a message that I would like to give to our members of the public. The second public health event that I would like to share today is the Ebola virus outbreak in Uganda. This is the Sudan type, and I'm happy to report once again that there is no new confirmed case or death of the Sudan strain of Ebola virus that has caused the outbreak in Uganda. It has now been about 25 days since the last confirmed case was reported, and this is a good indication that this outbreak is being brought under control. We are not saying it is over yet, but when we are at day 25, we are counting down and hopefully we will reach 10th of January, which will then be the watershed date. If there are no new cases, the government of Uganda will then consider what new message they will be able to give to members of the public, the continent, and the world at large. We are at day 25 without any new case, without any new death. But cumulatively, we have seen 142 confirmed cases. We have also documented 55 confirmed deaths across 9 districts in Uganda. Unfortunately, we have, out of all these cases, 19 are health workers. That makes 14%, and 7 of the dead are also health workers, and that makes 13% of the dead. It is a situation that we would really like to avoid because our health workers are in the front line, putting themselves at risk to ensure that you and me are safe, and we would like to keep them safe as well. All the known contacts of all the cases in Uganda have all completed their 21 days of follow-up, and that also strengthens our counting down towards January the 10th. The government in Uganda has also lifted the curfew and the movement restrictions, particularly in the 2 epicenter districts of Kasanda and Mubende. We are glad that members of the public have been very, very supportive despite the difficulties of travel restrictions, movement restrictions, and even curfews. Meanwhile, the government, through the Ministry of Health and with support from Africa CDC and other partners, have improved engagement with the community. Surveillance is continuing in the high-risk districts. Communities are being engaged so that we have dignified and safe burials in all the high-risk districts, including mandatory testing of all dead bodies, regardless of the cause of death, just to be sure that there is nothing hiding within one death to the other. We have also improved follow-up of survivors so that they know how to handle this situation of being a survivor of an Ebola infection. We want to make sure that all reservoirs have been addressed and there is no opportunity for another outbreak to catch us when we are just in the tail end of this particular outbreak. As Africa CDC, we are providing concrete support. Right now, we have just started training on mortality surveillance. How do we monitor deaths in the community? How do we document deaths in the community? How do we find out what the reason for those deaths in the community were? Very important for our context, especially where some cultures demand that burial is done quickly. We want to be sure that we have good knowledge of how to track these community deaths through this training for mortality surveillance. Secondly is we are training laboratory staff across the country so that they can be able to do proper sample collection. They handle it well during transport, and they take care of all the biosafety and biosecurity requirements so that everybody is safe. We also continue to work in the communities with village health teams supported by Africa CDC, continuing to provide information to the affected areas and the high-risk districts to make sure that everyone's sense of the need to protect each other remains high. I would also like to share a little bit of an update on the clinical trials. Two of the candidate vaccines have been cleared for use, and that is the Sabin Vaccine Institute, the candidate vaccine from Sabin Institute and NIH, as well as the one from the University of Oxford. The one from Merck IAVI is also undergoing the finalization of a regulatory process, and we are looking forward to all 3 different vaccine candidates be undergoing clinical trials in Uganda. And we'll await the minister to appraise us on where that process has reached. The third public health event of concern is a multi-country monkeypox, Mpox outbreak. You will recall that this outbreak, although it started in Africa, it has quickly spread to over 110 countries and territories globally. But the situation here on the continent is as follows. Since the last time that we had this briefing, a total of 45 new confirmed cases and 10 new deaths of Mpox have been reported from particularly the DRC and Nigeria. This is a 105% increase in the number of new confirmed cases and a 43% increase in the number of new deaths when we compare to the last briefing. All the new confirmed cases, that is the 45, were reported from Nigeria, while all the new deaths, 10, were reported from the DRC. So cumulatively for Mpox, we have 1,176 confirmed cases and 209 deaths from this particular outbreak across 13 of our member states. And really, it is a situation where we see 1 in every 5 confirmed case has actually been lost, something that we regret. And we are trying to ensure that does not continue to happen through working with the government to improve surveillance and management of cases when they have been identified. And also, we are finalizing vaccines for Mpox so that they can be able to be delivered. And our priority is going to be healthcare workers, at-risk population, including contacts, close contacts of those who have had Mpox. So this is being finalized, and we'll be able to let you know when we begin shipment and eventually a country-level vaccination against Mpox. Fourth is cholera outbreak. Since the last briefing, we have documented 1,692 new cases. We have also seen 43 new deaths as a result of cholera, particularly from Kenya and Malawi. Those are the highest numbers. Cumulatively, from the beginning of this outbreak, we have seen 83,150 cases. And we've also, unfortunately, documented 1,565 deaths from 14 of our Africa Union member states. And this translates to the continent is losing 1 person out of every 10 cholera cases. Now, when we want to just focus a little on Malawi today, on the 5th of December, His Excellency, the President of Malawi, Dr. Lazarus Makathi Chakwera, declared that the cholera situation in Malawi was a national public health emergency. And this galvanized all of us, including other partners, to actively support Malawi to bring this under control. Since the last briefing that we had, 1,091 new confirmed cases have been documented in Malawi and 41 new deaths in 21 of the affected districts. This represents a 19% increase in the number of new cases and a 70% increase in the number of new deaths. This is not a good situation, and we are working very hard to bring it under control. So for Malawi specifically, it means that we are losing 1 person out of every 33 cholera cases, and the majority of the deaths are due to very late presentation at the facilities. And it has been attributed to many cultural and religious beliefs. That's why people are coming late, and we are working with our social scientists to ensure that we have good community engagement to reduce the number of deaths, to encourage early presentation to the health facility, and therefore interrupt transmission. You will recall that all this started during a tropical storm Ana and a cyclone Gombe that hit the southern part of Africa, particularly Malawi, quite significantly. And therefore access to safe water, sanitation and hygiene has been quite a big challenge. In total though, 14 member states have been affected across the continent. And although Malawi is the one that we focused on today, and there's a lot of work that is going on to strengthen a response, Kenya has deployed its teams as well for rapid response, and we are working very closely with them in building capacity to ensure that the outbreak is brought under control as quickly as possible. We are training the environmental officers for water quality. We are training the health workers for surveillance and management. We have procured WASH commodities, that is water hygiene and sanitation communities, and we're also providing technical support to strengthen all aspects of preparedness and response to cholera for Kenya as well as for Malawi. The final public health event of concern that I would like to share today is Lassa fever. Since the last brief, 159 new cases have been reported, with 2 new deaths, and that's a case fatality rate of about 1.3% for Lassa fever. This is a 38% increase, 38% increase in the number of new cases, and a 50% decrease in the number of new deaths compared to the previous briefing that we had. Cumulatively, during this year, we have seen 9,235 cases with 222 deaths, giving us a cumulative case fatality rate of 2.4% for Lassa fever, reported from 7 of our member states, particularly in the Western Africa region, and to some extent, some few countries in Southern Africa as well. In response, what we have done is that we've mobilized a group of partners in a very multi-sectoral way to ensure that we are coordinating our support to the most affected countries. And we continue to work very closely with the affected countries as we monitor the situation. So these are the public health events of concern that I wanted to share with you today. Secondly is about the International Conference of Public Health in Africa. This year's conference brought together over 2,500 scientists, policymakers, public health stakeholders from all our 55 member states of the Africa Union. All of them were represented in Kigali last week. We are also very pleased to note that in total, we had 90 countries represented globally, and that means 55 were from Africa, and the other 35 were from elsewhere in the world. We are very pleased that it was a totally, completely global representation. We are also very pleased that 87% of the participants, 87%, were actually from Africa. And this is excellent news. The intention of this platform was to provide a space where our public health specialists, scientists, policymakers, partners can be able to come and have a very serious dialogue, how to safeguard Africa's health. And you can see 87% of the participants were actually from Africa. It was an excellent conference, 9 tracks, 34 conference sessions, spanning across many topics from digitization to health of women and leadership in health. And we had 165 speakers and moderators, 50 oral presentations, and 175 poster presentations. We had 59 side events over the conference period, all of them showcasing different aspects of public health, leadership, and research. So we are very pleased with the outcome of that conference. We were also very honored for the Prime Minister of Rwanda to open the event formally. And we also heard from many African ministers of health, in fact, even agriculture as well, and IT, education. They were all participating in different high-level sessions to elevate Africa's leadership in public health in this day and age. So the conference has been a huge success. We are putting together the outcomes, and we'll share that with you in the new year, so that you all can be able to see just how engaging the conference was and the key outcomes that we as Africa CDC have committed to support implementation of. Third is, I would like to update you on the Africa CDC's Youth Advisory Team. At the meeting, I made a commitment that I was going to form a small advisory group of youth to advise the Director General of Africa CDC on the best ways of engaging with the youth to improve the health outcomes on the continent. we've had a huge amount of interest. My intention was to announce it at the conference, but it was not possible because of the huge amount of interest. Out of the 200 eligible youth who participated in the Youth Pre-Conference, we are now filtering those numbers. We have reached just about a dozen, and I intend to cut that down further to ensure that we get a small group, representative of all our regions, representative of all the genders, to ensure that we have a good team that is going to advise me in the coming year on issues of engaging the youth in public health matters. So this I'll be announcing into the new year. And this brings me to the end of my submission, and I promise I take it back to you for any questions that we may have from the participants. Thank you very much.
Thank you very much, Dr. Ahmed, for your very extensive briefing today. And let's now move into our Q&A session. But before I take the first question, let me again remind colleague on how we can send your question. We can use our WhatsApp number. As I say, it's +251 909 537791. You can also send your question using the Q&A section, and you can also raise your hand to join us live to ask your question. So let me take the first question that I received here so far for Dr. Ahmed. I'm trying to open the questions. There is a question that we have here, Dr. Ahmed, from Justin Kui from Bloomberg. Justin is asking, tell us, Dr. Ahmed, what's new information you have about the Ebola vaccine trial ongoing in Uganda? I know you've mentioned it when we talk about the clinical trial. I don't know if you can also make any other further comment onto this question. And the second question, still on the topic of vaccine, this is from Kara Anna from Associated Press. Kara is asking about this, the vaccine, not on Ebola, sorry, it's on monkeypox. As the monkeypox vaccine donated by Canada a few weeks ago being distributed to member states, if yes, which specific country have received so far? Thank you, Dr. Ahmed, if you can answer those two questions.
Thank you, Promise, and Justine, for the Ebola Sudan type vaccine trials in Uganda. I had given a brief about that earlier in my submission, and we are awaiting field work to begin because the doses are now in Uganda, and the minister should be making the announcement in the course of today when the actual community work in these clinical trials will be able to begin. So let's just wait on that a bit until the minister makes that announcement. Kara Mpox vaccines, we have received donations from the Republic of Korea, and we are in the process of finalizing distribution of those particular vaccines. For other partners, including the European Union through their agency HERA, as well as the US government through their responsible agencies, we are in the finalization of discussions for additional doses for Mpox. And as soon as those are completed, then we will be distributing them. And when we start distribution, we will share where those doses will go within the member states of the African Union. As I had said last week, and I repeated today, the priority is going to be the countries where there is active transmission, and the targets are going to be health workers first, and then the high at-risk contacts and the high-risk communities as well. So just give us a little time to finalize which countries are going to receive the first donation from the Republic of Korea. And if we finalize, when we finalize the other discussions, we'll also let you know where others are going to be distributed. Thank you.
Thank you, Dr. Ahmed, for your answer. Moving to the next question, this is from Judith Apollo from KBC. Judith is asking, what is your overall impression about the CPHRA that I just had in Kigali last week? And when do we expect to see and to implement the outcome and recommendation of this important conference? Thank you.
Thank you, Judith. I am probably not the right person to ask my impression of the conference. The conference was excellent. It was excellent in all its ways. Majority African delegates, all 55 member states of the African Union represented, the youth and senior scientists and public health specialists and policymakers were there. Side events, 59. 9 tracks. It was an excellent meeting, and we're really looking forward to the 3rd edition next year in Zambia. The dates are going to be shared in the days to come. For the recommendations, we are just finalizing that. It's the week after the meeting, so the different leads of the different sessions are putting all their reports together. We will receive those as Africa CDC. And we committed that we are going to implement the recommendations as best as we can based on our resources and engagement with our member states. That was the reason for the conference, and we are still committing to be implementing those recommendations. They are being finalized, and I should be able to receive them in the next 2 weeks or so. And when implementation begins, we will be sharing that with members of the public here on this platform and elsewhere. Thank you.
Thank you, Dr. Ahmed. Before I take the next question, this is to also remind again on the WhatsApp number to use. It's a +251 909 537791. The next question, Dr. Ahmed, I know you talked about it already. It's about the youth advisory team. And this is Lucia Blanco from Africa Bureau asking about its composition and when this team is expected to start working. You've mentioned it already, and I think maybe you can again come on this. Thank you.
No, thank you, Lucia. The youth advisory team is a very important addition to our mechanisms of engaging the African public. I will be announcing this, as I said, in the coming week or 2 maximum, depending on how the holiday season moves. But for sure, by the beginning of the year, we will have them established. In fact, at the first press conference of 2023, this announcement will come through. Then how are they going to work? They're actually going to give us advice on how to engage with the youth more effectively. And they will be advisory in nature, so there will be consultations with them. My office will consult them on a regular basis so that we can be able to have their views being incorporated as we continue to refine our strategy, not just here on the continent, but also globally, because there are a lot of things that are happening within the health security space. So their role is going to be advisory. It is not full-time, and we will be engaging with them virtually and in person as the situation may demand. But I am going to make that announcement maximum January the 5th at the first press conference of 2023. A little patience there, Lucia.
Thank you, Dr. Ahmed. I think the briefing was very comprehensive. I'm not receiving any other questions for now. No hands up. I'm trying to look at the Q&A questions. All the questions have been addressed. So yes,
there's something in the Q&A side, I think.
Yeah, there's no question in the Q&A session.
I see something from Munya Makoni.
Oh, yes. Question from Munya Makoni. Yes. Sorry, my line is a bit. So Munya Makoni is asking, one highlight from health in Africa for me was when you were stopped by border security in Frankfurt Airport in October, despite a valid visa for Global Health Summit. How can you promote inclusivity in global health? What is the bigger picture for global health inclusivity?
No, thanks, Munya Makoni. The event in Frankfurt was not a public health event, but I will tell you that at Africa CDC, the Africa Union, our partners here on the continent, we are very clear in our minds that major global health events need to happen here on the continent much more often than they're doing now, because the issues being discussed, the solutions being proposed are directly related to our challenges on the continent. As Africa CDC, we took that responsibility and initiated the International Conference for Public Health in Africa. And the outcome of this second edition, the first in-person edition, has been just excellent. We know African scientists, African public health specialists, African policymakers are hungry for a platform where they can be able to come and discuss what affects them, and the recommendations are then taken forward and implemented. We are doing that. Other partners are doing that as well. AMREF has a conference in March in Kigali as well. In 2023, I encourage all of us to attend that. It's another very important platform for African public health community. So we are progressively opening the space for African events being held in Africa, addressing African challenges, offering African solutions, which are then going to be implemented by African institutions. So that space is already open, and this conference was a fast stop, and more are going to come. Our plan is to have more platforms that are going to be more specific to certain areas, certain experts, and so watch this space. We are going to ensure that the African continent is hosting as many as possible of these forums that are addressing our issues within the global health architecture. So just the beginning, Mike.
Thank you, Dr. Ahmed. Moving back to Africa, there's a young medical doctor in Uganda who is also following the press briefing, and he has two questions for Dr. Ahmed. The first one is, have we identified the serotype causing cholera outbreak in Malawi? And secondly, do you advise on, what is your advice on Ebola Zaire vaccination in area that have Ebola Sudan as preventive measures? Thank you.
Okay, thank you for those two questions. One is cholera. We are sequencing all the hotspots, and that data is not yet in. We are going to make that data public as soon as it gets in, because we want to see where exactly is the cholera strains that we are seeing, where are they coming from, and if they're any different from what we've seen before. So that data is being collected from all the hotspots of cholera on the continent, and we are sequencing those. We'll share that as soon as the results are in. Second is on vaccination. Let me segue a bit, and I've just received new information here that all three candidate vaccines for the Sudan type of Ebola virus are going to undergo clinical trials, and doses that have arrived in Kampala already are a total of about 5,200. Cutting across all the three types, the one from Sabin and NIH, the one from Oxford, and the one from Merck and IAVI. So that is very good news that all three candidates are going to be tested. Very important moment for public health on the continent when we are getting clinical trials for the Zaire type, the Sudan type. Now, in as far as the vaccination is concerned, across the two types, we still do not have evidence that one protects the other. The evidence we do have already is that the Zaire type vaccines for the Zaire type do not protect for the Sudan type. Now, whether the vaccines for the Sudan type would be able to protect for the Zaire type, this is still not evidence that we have. And as we undergo the clinical trials, we will see if we can be able to produce some decent results that will guide whether it is possible to use the vaccine for the Sudan type on an area where the Zaid type is more predominant. We will follow the evidence, and when that is made available, we will take appropriate action. For now, we are very supportive of the clinical trials that are going to begin in Uganda shortly for the Sudan type, made up of these 3 vaccine candidates. And we are also very supportive that the existing vaccines for the Zaid type of the Sudan virus are actively given to our health workers in the front line and also to the at-risk communities, so that we arrest any outbreak as early as possible. And we are in discussion with the manufacturers of the vaccines for the Zaid type, so that we continue to actively do some vaccinations, especially now when there is no outbreak. We don't have to wait until when there is an outbreak. So we're very supportive of these clinical trials, and we are very supportive of vaccinations for all types of the Ebola virus. Thank you.
Thank you so much, Dr. Ahmed, for your answers. And as we're going out to the end of our press briefing, there is no question so far. Oh, sorry, there's a question in now. This is Crispin from Teles Account in DRC. Is asking, it's just a comment that he's been following some news on what is going on in China, and asking, shall we be cautious about the situation in COVID and new cases in China, and in any impact that can have in Africa? Thank you.
Every outbreak anywhere in the world is a risk for everywhere in the world. So when we see cases rising in any part of the world, and right now there are cases in at least 4 different hotspot areas across the globe. So we as Africa must take the necessary precautions because we travel so easily today, and at any time we could be able to see a surge here on the continent. And that's why we are working very closely with our governments on the continent to ensure that we enhance our surveillance and we continue to be awake to the fact that whenever there is a surge anywhere in the world, Africa is immediately threatened. So yes, it is important for us to be ready. We must vaccinate as much as we can. We must ensure members of the public are aware that there is a surge elsewhere in the world and we are at risk. We must ensure that our systems are ready to be able to pick out the first cases, contain them, and avoid any active community spread, to avoid another surge here on the continent.
Thank you, Dr. Ahmed. And that was our last question for today. And as we conclude our press briefing, I would like to invite you, if you can share your 3 key headline points of as we are concluding also the press briefing for the year, before we conclude our press briefing. Thank you.
Thank you very much, Promise, and thank you to all of you who have participated today. My 3 messages for you. Let me start with cholera. There's a lot of flooding across the continent of Africa, and the after effects of floods that came and have now subsided. We need to take care of our environment in a way that ensures that the cholera pathogen does not spread. Let us be awake to the fact that cholera is actually present in different parts of Africa, and we must actively protect ourselves with good information, good hygiene, as we go on with our lives. So this is one about cholera. Second is Ebola. We are on a countdown in Uganda, and that is a very good thing. We are just about to start clinical trials in Uganda, and that is very, very important for future preparedness and response. We want the situation to remain exactly that. of no new cases for Ebola in Uganda or anywhere else here on the continent of Africa. And that takes you and me to be able to ensure that there is no further transmission. Let's listen to our ministries of health and the agencies that are responsible so that we do the right thing. Whether it is Ebola, whether it is any other hemorrhagic fever, whether it is any other condition, Rift Valley fever, yellow fever, Lassa fever, let's listen so that we do the right thing, particularly during this period. For COVID-19, get your vaccine, get yourself fully vaccinated and get boosted if there is that opportunity. For anyone who is 60 years and above, get your vaccination, get your booster. For anyone who has comorbidity, get your vaccination, get your booster for COVID-19. It is extremely important during this time that you remain safe. Finally, we are going into holiday season, and I would like to first thank all of you for being with us for the last whole year as we come here on a weekly basis and share with you what's going on the continent and what we are doing to safeguard Africa's health. Thank you very much for being part of this a very important journey. And as we commune with our friends, with family, as we travel across Africa and beyond, let's be awake to the fact that pathogens are still there and they travel with us. Let's be awake to the fact that at any time an outbreak can be able to explode and expand depending on how me and you behave when there is an outbreak. Let's be awake to the fact that not all infections have treatment, not all infections have vaccines, and not all infections are fully understood by ourselves as public health experts. So your ability to reduce the risk of transmission is the first part of our strength in terms of response. So during this holiday season, stay safe, avoid huge gatherings, and whenever you get the first symptom, please have that checked. Remember, your health workers also need protection from you, so you inform them in advance how you're feeling so that they take the appropriate measures and precautions to manage your situation and to protect themselves, their families, and other patients as well. This holiday season, let it be one of responsibility. Let this holiday season be one of us taking care of ourselves, our neighbors, our families, and the people around us in a way that interrupts any transmission and stops any new infection from spreading to become large. I wish you all a very, very fine end to the year, and I wish you an even better 2023. Happy holidays, and you stay safe.
Thank you so much, Dr. Ahmed. Thank you for making your time today again for the briefing. Thank you to all our colleagues online, the media online, for your partnership throughout 2022. And we also thank you, our colleague at Africa CDC, but also the AUDIC for working behind the scenes. So please make your time to join us in our next press briefing, which will be in 2023. And for now, happy holidays to you all and your family. Goodbye. Stay safe. Thank you.
From the Africa CDC Specialized Agency of the Africa Union. As I look back at the year 2022, I look back with gratitude at what we, as Africa CDC, with your support, have been able to do in securing Africa's health. We have been able to do this because of the generous support from our member states here on the continent of Africa, because of generous support from our partners outside of the continent, from the smart, excellent work that is being done by Africa CDC staff across the continent of Africa. As I look forward to 2023, I look at that year as a year that is full of hope, a year that we can be able to walk into with confidence if we prepare well for it. In the space of disease outbreaks and health emergencies, at Africa CDC we are doing exactly that. And I would like to call upon you to make our work a little easier. This holiday season, let us be awake to the fact that COVID is still here with us. Let us be awake to the fact that many other viruses, Ebola, Lassa fever, yellow fever, Rift Valley fever, and other pathogens like cholera and malaria are also still here with us. As we gather together, let us do that with responsibility. As we gather together, let us do that with a sense of wanting to protect ourselves and to protect those who are around us. Let us make this holiday season one that is safe and one that ensures that no other health emergency happens as a result of us coming together. I would like to thank each one of you for the contributions you've made to Africa CDC's success during the past 6 years of our existence. And I would like to call upon you and urge you as well to continue to support our work so that we can be able to secure this continent from disease outbreaks and health emergencies. Join me in congratulating Africa CDC staff who have worked hard for the last 3 years during this pandemic and who continue to work smart as we prepare for any other outbreak that is going to come. They are your frontline soldiers in the field of health security, and they deserve your support and your acknowledgement and your thanks as well. Join me in thanking our leaders who continue to give us all the tools that we need, be they technical, political, diplomatic, or financial. I thank each one of you for the role that you continue to play in ensuring that Africa CDC remains the premier health organization for this continent. Have a very safe holiday season. Greetings from the Africa CDC Specialized Agency of the Africa Union. As I look back at the year 2022, I look back with gratitude at what we, as Africa CDC, with your support, have been able to do in securing Africa's health. We have been able to do this because of the generous support from our member states here on the continent of Africa, because of generous support from our partners outside of the continent, from the smart, excellent work that is being done by Africa CDC staff across the continent of Africa. As I look forward to 2023, I look at that year as a year that is full of hope, a year that we can be able to walk into with confidence if we prepare well for it. In the space of disease outbreaks and health emergencies, at Africa CDC we are doing exactly that. And I would like to call upon you to make our work a little easier. This holiday season, let us be awake to the fact that COVID is still here with us. Let us be awake to the fact that many other viruses, Ebola, Lassa fever, yellow fever, Rift Valley fever, and other pathogens like cholera and malaria are also still here with us. As we gather together, let us do that with responsibility. As we gather together, Let us do that with a sense of wanting to protect ourselves and to protect those who are around us. Let us make this holiday season one that is safe and one that ensures that no other health emergency happens as a result of us coming together. I would like to thank each one of you for the contributions you've made to Africa CDC's success during the past 6 years of our existence. And I would like to call upon you and urge you as well to continue to support our work so that we can be able to secure this continent from disease outbreaks and health emergencies. Join me in congratulating Africa CDC staff who have worked hard for the last 3 years during this pandemic and who continue to work smart as we prepare for any other outbreak that is going to come. They are your frontline soldiers in the field of health security, and they deserve your support and your acknowledgement and your thanks as well. Join me in thanking our leaders who continue to give us all the tools that we need, be they technical, political, diplomatic, or financial. I thank each one of you for the role that you continue to play in ensuring that Africa CDC remains the premier health organization for this continent. Have a very safe holiday season.